Now we'll talk about current recommendations that is related to COVID-19. So the current recommendations, and as we know, current is always changing, but the current recommendations are that everyone 2 years or older who is not fully vaccinated should wear a mask in indoor public places. So in general, you don't need to wear a mask when you're outdoor settings, but if you are inside, everyone in general should be wearing a mask. In areas with high numbers of COVID-19 cases, you should consider wearing a mask even in crowded outdoor settings or in activities with close contact with others, especially if they're not fully vaccinated. And then people who have a condition or are taking medications that weaken their immune system means that they might not be fully protected, even if they're fully vaccinated. So they should continue to take their own precautions and that are recommended for unvaccinated people. So that includes wearing a well-fitted mask, and this is until advised otherwise by their healthcare provider. If you are fully vaccinated, to maximize protection and prevent the possible spreading of COVID-19 to others, you should wear a mask outdoor or public if you are in an area of substantial or high transmission. And we'll talk about the community levels in the next slide. Effective February 25th of this year, the CDC does not require wearing a mask on buses or vans operated by public or private school systems, including early care and education or child care programs. Now that's what I meant to start that. Sorry. Because there's just one blurb I want to read on this one. Should we go? Go back to the slide.
Well, is that the beginning of the slide though?
Of the slide or the presentation? This is the beginning of the slide.
Oh, gotcha.
Yeah. No, that's fine. I just wanted to go back. If you are fully vaccinated, to maximize protection and prevent possible spreading of COVID-19 to others, you should wear a mask indoors in public if you are in an area of substantial or high transmission. And we'll talk about the community levels on the next slide. Effective February 25th of this year, the CDC does not require wearing a mask on buses or vans that are operated by public or private school systems, which includes early care and education or child care programs. However, the US government does still have a mask mandate for public transportation that includes planes, trains, airports, and transit hubs. They've extended that through May 3rd. So there's two distinctions. One, if you're in a public area, planes, trains, buses, airports, you should be still wearing a mask, but they are no longer requiring them for buses or vans operated by the public or private school systems. Also, I will say that in areas in communities with low transmission, mask use is just based on personal preference. I'll go ahead and go to this slide and show you the low, medium, high. In low transmission, masks are based on personal preference and risk assessment. Medium, if you're in the medium area, people who are at high risk for severe health impacts, if infected with COVID-19, those are the people that are immunocompromised, people that have a lot of chronic conditions. They should still be wearing a mask. They strongly consider wearing a mask in indoor public settings for additional protection from COVID-19. And then if you're in high setting, people should wear a mask in indoor public settings, including schools and workplaces. So this is the community level chart. The CDC recently kind of updated how they decide what area each county is in. And as you'll see, the fewer than 200 new cases per 100,000 people can still be low, medium, or high risk. It just depends on how many new admissions in the hospitals. If there's over 200 new cases within a population of 100,000, then you're automatically at least a medium level and potentially high level, depends on how many inpatient beds are occupied by COVID-19 patients. You're not expected to know the math, but at the bottom of this slide, it does tell you how they determine those levels in the community. You can find this community level tool using this QR code. And if you use this, it'll take you to the CDC website. You use a drop-down menu to choose Arkansas, then you use another drop-down menu to choose the county that you're in, and it'll tell you what your current community level risk is. In Arkansas, at the time of filming this, almost all of Arkansas is low transmission, except for about 7 counties that are around the Little Rock area. I think extending down to Hot Springs, those are considered medium risk at this point. So, as we all know, information changes regularly. You need to It's not realistic to always have the latest, most up-to-date information. That is something that we will be helping provide you. You do need to make a plan on how your team can stay on top of the latest information and recommendations. One of the things that we will be doing is having monthly training and a monthly newsletter that will kind of stay fairly up-to-date on this. But as we know, current is each day. And so if you're just relying on new information once a month, there could definitely be some changes earlier in that. So be sure to use some of these resources to kind of stay on top of the new recommendations. It should include a list of information resources, especially the ones that we've provided, that you can easily access. Oftentimes these questions come up when you're having conversations with community partners. They might ask something and you say, I don't know that off the top of my head. And you don't want to search through a bunch of different information to try to find that. If you have some of these, that's why I provided some of these QR codes. It kind of gives you that quick information as a toolkit for you. So to find these credible and reliable resources on COVID-19 vaccine, the CDC's Immunization Safety Office communicates timely and transparent information on the CDC vaccine safety site. You can visit that site, you can type it into Google and get some of this information. If you search for vaccine information, consider guidance from these sources. The Immunization Action Coalition, they have suggestions for questions you should ask whenever you're reading new information. The National Network for Immunization Information, they suggest questions to ask when you're evaluating information. So this is when you see a new guideline or you see a new source of information that might not be from cdc.gov. Whenever you see this new information, whether it's social media, generally not a great place to get new information unless you're using these type of resources to ask questions about that information and can you trust it? So the University of California, San Francisco's website, they have red flags that you should know about whenever you're discerning how accurate information is. And then Medical Library Association helps translate some of that medical language into common language that everyone should be able to understand. So these are good resources for determining if a source of information that you're reading is accurate. Here are a couple QR codes that will take you to some mostly videos or documents. The National Resource Center for Refugees, Immigrants, and Migrants, they have over 8,000 documents and it's in over 100 different languages. So if you're in the community having a conversation and you're not able to fully communicate with someone, you might be able to go to this site. Again, there's a drop-down menu with what language you're looking for, and then it'll list out the different types of documents they have that are translated, and they're almost like flyers. They just give succinct information that you can help provide someone that you might be having a conversation with in the community. And then the conversation, they have over 300 videos in English and in Spanish that are all very short. I think they're less than 3 minutes each. They give great information on the vaccine, on COVID-19. They're all provided by people of color. So this is a great resource whenever you might have a client that is using some misinformation these videos kind of help. It comes from a provider, it comes from a person of color, and it explains some of this information that people hear. And if you don't have the answer right away, you might be able to find some of these resources to present to your clients. Thanks for listening.